COPD stands for chronic obstructive pulmonary disease, which is a very important cause of death in the world. And very early in my career, I understood that COPD was caused by smoking cigarettes or tobacco and exposure to poor air quality in our homes when we burn charcoal or firewood. Very early on in my career, I met a lady in whom I diagnosed COPD, but she didn't have any of these box standard causes for COPD. And later on I realized that she worked in a factory that manufactured plastic products for more than 20 years. And after doing a lot of literature reviews, I realized that exposure to poor air quality in our places of work can cause COPD. COPD is a condition in which patients get clogging and narrowing of the airways in the lungs and damage to the lungs per se. And this usually results in a lot of coughing that never really goes away, production of mucoid sputum or phlegm, recurring infections, so every now and again chest infections, and noisy breathing. And it's a condition that occurs in people who smoke tobacco a lot, but we know there are many other causes for it, usually related to breathing poor air quality. Some diseases like tuberculosis can result in a COPD as well, even when fully treated and cured. The commonest symptoms of COPD are a cough, and this cough is persistent, or even when it resolves, it comes back again and again. It usually is productive of sputum or phlegm, which is mucoid in nature. People who have COPD get breathless initially with exertion, but over time the breathlessness becomes even at rest, and people can get disabled with breathlessness due to COPD. They may have noisy breathing. Usually they have a wheeze, very much like that of asthmatics, and they may have other types of noisy breathing. And they tend to get recurring chest infections. So they may have bronchitis now and again, they may have pneumonia now and again, and other lung infections. A diagnosis of COPD is made in these people when they have spirometry, which is a fairly specialized test done by healthcare providers, measuring flow of air through the breathing tubes during forceful breathing. Most drugs used to treat COPD will either attempt to dilate the narrowed airways and unclog them. They may help remove the sputum by making it less in amount and less in tenacity. Most of these treatments are available in tablet forms and in inhaler devices. And the inhaler devices are really effective in this regard because they deposit the drug right where the problem is, inside the airways. The most important thing that patients with COPD must do is to stop exposure to the causative problems. For instance, smoking tobacco, so they need to stop that. If they don't, then the condition is progressive. You can arrest progression by stopping exposure to cigarette smoke. It's important to note that people who don't smoke but are exposed to secondhand smoke can get COPD. The other thing is to exercise, and this is good because it improves breathing. It maintains muscle mass, which is really important, and it helps with the unclogging of the airways. Healthy lifestyle, including healthy diet, is really, really important.